So in this video, we're going to talk a little bit about the treatment plan and what you can expect throughout care. So now, first thing I'll say is everybody's a little bit different. This makes sense. Everybody heals at a little bit of a different rate. So these guidelines we are going to give you are based on the general population and based on the average treatment plan that we see in our clinics. So general treatment plan will average anywhere between 8 to 12 weeks. Now, I'm going to map it out at 12 weeks simply because of one thing. Physiological change takes time. It takes time and it takes effort. So I'm going to give this analogy. If you were to go to the gym and go twice, would you expect to be fit? Probably not. Reason is the body takes time to make those changes. And another analogy is if you break your arm, you're in a cast for 6 weeks. Why? Not an arbitrary number. Generally, it takes about 6 weeks for the body to stabilize an injury. So a back injury, a neck injury, a knee injury, any injury in your body follows that same path because it takes that amount of time for the body to rid of inflammation, for healing to start, and for repair to begin. Quite often, that first 6 weeks is just the beginning of healing from an injury. That's normally when you'll feel it the most. After that, the body does its thing generally without you interrupting it. So most of the patients that experience chronic neck and back pain, they've come to a point which is called limitation of matter, which means up to a certain point, the body can deal with things without letting you know, without giving you pain, without affecting your function. When it gets to a certain point, that's the threshold. And then the body says, hey, you know what? You got to do something about this. It creates pain signals. It reduces your function. The body's very intelligent that way. And in that way, if you give it a little bit of a help, it will actually help heal itself as well. It will do some of the work for you. But when it needs help, that's when you need to do something like seek outside care and support the body in ways to make sure that it will start to heal itself. So the spine specialist is the most advanced treatment for back and neck pain on the market. It's been designed that way. So with that, there is a lot of capability that this machine has that your doctor can utilize to help you get better as fast as possible and to attain your recovery in the most complete way as possible and keep you out of pain. So there are 3 essential phases to care. First being your acute phase, second being your rebuilding phase, and third being your maintenance phase. Generally, that first phase lasts 4 to 6 weeks. In that first phase is what we'll talk about right now. The first phase will generally start to reduce inflammation. It will start to create a little bit more elasticity in tissue. And what that means to you is you'll be able to move a little bit better because that tissue that was all tight will start to become a little bit more flexible. The reduction of inflammation may cause a little bit of reduction in pain as well, because inflammation creates pain. The more inflamed you are, the more pain you will have. In fact, a lot of MRI studies that have been done on disc injuries, they've found that if a disc is injured, it'll only hurt if it's inflamed. Many people are walking around with disc injuries that they don't even have any idea they have. When they start to get inflamed, that's when the body starts sending that pain signal. So you'll have reduction of inflammation, you'll have elasticity of tissue, and you'll start to have improvement of hydration of the disc that has been compressed, squashed, and dehydrated. So within that first phase, 4 to 6 weeks, you'll start to get all those things happening. The next video, we'll talk about the next phase, which is your repair and regeneration phase.